Hi guys, it's me, Professor D. Welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot and we're going to be covering mental health disorders. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, I have plenty of resources available. You can sign up for a next generation NCLEX review session. You can sign up for a private tutoring session, a consultation session. If you're currently in a nursing program and you're really studying, you have to do really well on your next exam. I've got audio lessons available. I've got lots of resources. The website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, and right here on YouTube. My handle's the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. All right. Mental health. We're going to be covering mental health disorders. First question. Your patient with bipolar disorder is having a manic episode. Which nursing intervention would be best to manage the patient's behavior? Would it be encourage the patient to join group activities to increase social interaction? Would it be to provide high-calorie finger foods or drinks? Would it be to discourage a patient from engaging in any form of exercise? Or would it be to limit the patient's fluid intake to reduce hyperactivity? So your patient is diagnosed with bipolar disorder is having a manic episode. Which nursing intervention is best to manage the patient's behavior during this time? What's the best thing to do? Very good. Provide high-calorie finger foods or drinks. Now, I'm concerned that 48 of you guys chose the wrong option, but let's talk about the right option first, and then we're going to talk about the wrong option. So the right option, high-calorie finger foods or drinks. Why high calorie and why finger foods drinks? Those are the two things you need to know when it comes to bipolar disorder and that patient's in the manic phase. So if the patient's in the manic phase, manic, mania, that means they're up, they're going, they're going, they're going, they're going. They are not stopping, okay? Their metabolic rates increased, they're going, they're burning calories, but they're not even stopping to eat or drink. So physiological integrity is going to be an issue. That patient needs food and drink to stay alive. By the way, if you ever get a test question about a patient, same thing. They're a bipolar patient. They're in the manic phase, and there are four things wrong with them. Which one are you going to be most concerned about? And one of them happened to be food or drink. Food is an option. Drink is an option. What are you going to choose? I'm telling you right now, every day of the week, fluid and electrolytes is going to take precedence over nutrition. And the reason for that, whenever you're thinking about priority, you have to think about what's going to kill your patient the fastest, right? You can go weeks without food, but you can only go days without fluids and electrolytes. So that's why fluids and electrolytes. So for this patient that's in the manic phase, they're burning all these calories. They're going. They're not stopping to eat or drink. You're going to give them finger foods because guess what? They're not going to stop, sit down to have steak and potatoes. Absolutely not. They don't have time for that. They got to go. They need food on the go. So you're going to give them what? A sandwich so they can eat while they're going. You're going to give them a bottle of water so they can do what? Drink while they're going. Physiological integrity, okay? That is going to be your biggest concern. Now, let's talk about the wrong answer choices. 48 of you guys chose this over nutrition and fluid and electrolytes. 48 of you guys said encourage the patient to join group activities to increase social interaction. Are you serious? Are you serious? So this patient that's going, they're in the manic phase. They're talking to everybody. They're talking a mile a minute. Social interaction, they've got a little bit too much social interaction going on. That patient that's in the manic phase, if you dare put them in a group setting like group therapy, they are going to be, everyone in that group therapy is going to be ready to wring that patient's throat. Absolutely not. Okay? They don't need social interaction. They got enough of that going on. okay? That patient that's in the manic phase, they are on top of the world. They make rash decisions. This is when, they'll gamble all their money away or give all their money away, or they may wear inappropriate clothing. They're just on a high and they're going, going, going. So absolutely not. Absolutely not. Let's look at our other choices. 6 people chose discourage a patient from engaging in any form of exercise. I'm happy only 6 people chose that, because guess what? They're going. And last, limit the patient's fluid intake to reduce hyperactivity. No, they're not drinking enough. We actually want to do what? Increase their fluid intake. How are you guys doing on the live? We just started. This is the first question. All right. So that's why high calorie, number 1, finger foods and drinks. Number 2 are very important when it comes to the manic patient. You have to give them something that they can take on the go. And we want it to be high calorie because they're burning so many calories. We need to replace it. Okay. All right. Your bipolar patient reports hopelessness and lack of energy. Which nursing intervention is a priority to promote the patient's recovery? Encourage the patient to perform activities independently to boost self-esteem. Encourage the patient in physical exercise classes to elevate mood quickly. Set small, achievable goals and provide praise for completed activities, or provide detailed explanation of treatment plan to increase understanding. Your bipolar patients reporting hopelessness and lack of energy. What are you going to do? Very good. You're going to set small, achievable goals and provide praise for completed activities. So we're talking about the same diagnosis, bipolar disorder, but instead of being in that high, having that mania, the patient's the opposite way now. They're in that low. They have what? Depression, right? Here is a good way. I want you guys to think of depression so that you can answer your test questions a lot easily, okay? When you're thinking of depression, because this is where the patient is in bipolar disorder, not the high, they're in the low, they're in depression. Depression is anger, hostility, resentment. Those 3 things turned inward, turned towards self. I'm so dumb. I'm so stupid. Nobody loves me. Anger, hostility, resentment turn towards self. They feel hopeless. They have lack of energy. They don't want to do anything. Nothing's worth doing for them, right? So one of the most important things you want to do is provide very simple, very small tasks that you know for sure they can accomplish. You cannot give a patient that's depressed, you cannot give them a task that there's a remote possibility of them not being able to achieve, because you're going to make the depression worse. Because remember, anger, hostility, resentment is turned inside towards self. You don't want to make it worse. So giving them a simple task as washing a dish. They wash that dish and you say to that patient, Mr. Such and such, you did such a great job washing that dish. Thank you. Why are you doing that? Number 1, you're giving them something to do, right? Because guess what? If they really were not worthy, they wouldn't be worthy of having something to do. You're giving them something to do. And then once they do it, you praise them. You let them know that you really are worthy. Just by saying thank you, you're letting them know that they're worthy. Let's look at the wrong answer choices. Encouraging a patient to perform activities independently to boost self-esteem. They're in the depressing portion of bipolar disorder. So you're not going to give them independent tasks, because remember, they're depressed. They don't have energy. They don't even want to do anything. You give them a task and walk away. You think they're going to complete that task? Absolutely not. That's number 1. And then number 2, they're going to feel even worse about themselves because I'm such a loser. I didn't even have enough energy to complete this task. I knew I was a loser. They're going to feel worse about themselves. So we're not going to do that. 5 of you guys chose engage the patient in physical classes to elevate the mood quickly. They have lack of energy. Number 1, you have to build them up to enough energy to do physical exercise. That's number one. And number two, it's not going to be a class around a whole bunch of people because we're trying to boost their self-esteem, not make them feel bad about themselves. They're going to be looking at everybody else on the treadmill or the bike going so fast, and here they are like a little turtle. They're going to feel worse about themselves. That's number two. And number three, what is the one word in this whole sentence that should have made you know that this answer choice is wrong? Guys, in the blue option where it says engage the patient in physical exercise classes to elevate the mood quickly. What is a what? Thank you. Quickly. The minute you saw quickly, you should have said to yourself, because patients don't come out of that depression quickly. Let me tell you something. Here goes another test question you better know. If you ever get a test question about a patient that has depression, and they've been prescribed anti-anxiety, not anti-anxiety, antidepressant medications, and all of a sudden, they're happy. All of a sudden, they have energy. All of a sudden, they're socializing, things they weren't doing before, but quickly, all of a sudden, they're doing it. Are you going to be happy to say, oh my gosh, my patient's recovered, I'm such a good nurse? Absolutely not. You're going to be weary. You're going to call the healthcare provider and be like, Mr. or Mrs. such and such suddenly is so happy and has all of this energy. Yeah, we need a one-on-one sitter. What are you suspecting? The reason they have all this energy is because they finally have come to the conclusion that they're going to themselves and they know how to do it. Right? They've been watching the nurses. They know when the nurses go off shift, when the new nurses come in, they know when they give report, they know when the nurses are doing their rounds, right? And they finally calculated when is the perfect time to take all those pills, or when's the perfect time to hang themselves, that nobody's going to catch it in time, that they're finally going to be released from all this pain and anguish that they're feeling inside, right? Now that they finally come up with a plan and they know that they're going to be leaving this world soon, they're giving away all of their prized possession, everybody that they even cared about, they're letting them know that they love them, right? They have all this energy. Why? Because they have a plan and they're about to carry out that plan. Okay? So be careful with that word quickly. And then last, only one person chose this. Provide detailed explanation of treatment plan to increase understanding. Are you kidding me? Number one, when it comes to education, that is last on our list when it comes to Maslow's hierarchy of needs. We care about the patient's physiological integrity. We care about keeping them alive before we care about teaching them anything under the sun. That's number one. Number two, this patient has depression. When a patient has depression, they not only have a lack of energy, their thought process, their cognition has declined. Their thinking is slow. You have to actually provide the opposite. Very short instructions. They cannot process thought where you're giving them lots of information because their thought process has slowed down significantly. So I'm happy only one person chose that. All right. Your priority, you're going to give them very short, achievable tasks. And if you have to give the patient directions, they're going to be very short and to the point. Okay. Thank you, Jason. This is being recorded. This is live, guys. This is live. However, after this live session, I posted on my YouTube channel. So if you want to go back and watch, just go to my YouTube, Nexus Nursing. Third question. Which statement about lithium indicates a need for further teaching? Here are your options. I should drink plenty of water throughout the day to stay hydrated. I'll avoid salt in foods that contain sodium. I'll have regular blood tests to monitor my lithium levels, or I need to let my doctor know if I start feeling nauseous. Which statement about lithium indicates a need for further teaching? Okay, the correct answer is I'll avoid table salt in foods that contain sodium. Now, before I get into this and teach about this, guys, you guys that are on the live, please ignore the negativity. Ignore it. I love that you guys are coming to my defense, but it's okay. It's okay. It's okay. I promise. There's always going to be someone that doesn't think what I'm doing is good, or that I'm dumb, or that I'm aggressive, or whatever it is that they're saying about me. That's okay. Just focus on learning this information. And everybody that came here to learn, that's what you came for. Get this information. Don't worry about the haters, because I don't. I promise you I don't. You guys don't even have to defend me. Don't get distracted, okay? All right. Let's talk about lithium. So, this question's asking us which one requires further teaching. Whenever you get a question that's asking you what requires further teaching, which requires clarification, which requires follow-up, what you're really being asked is which one is the wrong answer choice, right? And the wrong answer choice here is saying, I'll avoid table salt in foods that contain sodium. And here's why it's the wrong choice. When you're going to be on lithium, we don't want you to change your sodium intake, because why? We need a steady level of sodium. So however you've been having your sodium intake, that's what you need to keep it as. Why? We don't need your sodium levels going up or down. Something you need to understand about lithium, guys. First of all, you need to know what the therapeutic range for lithium is, and that's 0.6 to 1.2. Once you hit higher than 1.4, patients in lithium toxicity. Professor D, do I need to know this? Absolutely. You very well may see it on NCLEX if you're currently taking mental health. You're going to see it as a test question some way, somehow. I guarantee you that. So you need to know the therapeutic range for lithium. You need to know when the patient's in lithium toxicity. And you need to understand that sodium affects lithium level. Now, sodium, the therapeutic range for sodium is 135 to 145. That is the therapeutic range. 135 to 145. If the patient has too much sodium, the patient's hypernatremic, that means the sodium is higher than 145, that can cause the patient to have a subtherapeutic level of lithium. That means the patient's not getting enough lithium in their system. If the sodium's too high, the lithium will be too low. Now, in the opposite way, if the patient's sodium level is too low, they're hyponatremic. That means the sodium level is less than 135. Guess what that can cause to the lithium level? Toxicity. It can cause the lithium level to be too high. So we want the patient to have a steady stream of sodium in their body. We don't want them to change anything, okay? Now, all of the other options are good. It doesn't require further teaching. I should drink plenty of water throughout the day. Absolutely. We don't want that patient being dehydrated on lithium. Are you crazy? I'll have regular blood tests to monitor my lithium level. Absolutely, because lithium has a therapeutic range. Again, 0.6 to 1.2. Once you're higher than 1.4, patients in lithium toxicity. And last, I need to let my doctor know if I start feeling nauseous. Absolutely, because that, along with some other symptoms, can possibly be symptoms of lithium toxicity, which is very dangerous. You have to watch out for those symptoms. How are we doing on the live? Okay, let's keep going. A patient taking lithium presents to the emergency room complaining of tremors, nausea, confusion. Which lab value would you suspect? Lithium level of 0.8, lithium level of 1.2, lithium level of 1.4, or lithium level of 2. And guys, I literally told you the answer in my last explanation. Everyone should get this right. Very good. Lithium level of 2. Remember, therapeutic range for lithium is 0.6 to 1.2. Once that level is higher than 1.4, that patient is in what? Lithium toxicity. Your patient is diagnosed with a major depressive disorder and they are at risk for suicide. Which intervention would you prioritize? Here's the options. Encourage the patient to engage in group therapy sessions. Assign the patient with a one-on-one caregiver. Allow the patient to spend time alone for self-reflection. Or suggest the patient write about their feelings in a journal to express emotions. And I accidentally gave you guys the answer to this, explaining something else. Everyone should get this correct. That's right. One-on-one caregiver. And when I say one-on-one, literally one-on-one. They're on your, you know what? You go to the bathroom, they go to the bathroom, right? Because you're not going to go to the bathroom and pretend like you have to use the restroom and off yourself in the restroom. And now that sitter has lost their job because they didn't do what they were supposed to do. Matter of fact, let's take a step further because now the UAPs, most states, not all of them, but most states, their license is not just a certification anymore. You have to have a license from the state. So you're going to be before the Board of Nursing for that license. Okay. Physiological integrity. We care about what's keeping you alive first before we care about anything else. So let's look at the wrong answer choices. The first one, encourage the patient to engage in group therapy sessions. If they're depressed to the point that they're suicidal, we're not having them be part of any group sessions because they already don't feel worthy and they're going to feel worse about themselves. We're not doing that. And that wouldn't be our priority anyway. Next, allow them to spend time alone. Really? Spend time alone so they can off themselves? Absolutely not. And then last, suggest the patient write about their feelings in a journal to express their emotions. That is a great nursing intervention. That's a great teaching, but it does not take priority over the one-on-one. Because how are you going to be able to write in the journal about your feelings if you're dead? Right? Now, with that being said, another famous question that you may get that you need to be aware of, it'll go something along the lines of, you're the nurse on the psych ward unit that has a patient that's been admitted, and they make a comment, they make a statement, they say something like, life isn't worth living anymore. What is going to be your reaction, or what do you say? I'm telling you right now, whenever you're presented with a situation where a patient may possibly be suicidal, the first thing you do, ask them directly, are you having thoughts of harming yourself? You don't beat around the bush. You have to ask them directly when it comes to suicide and when it comes to abuse. Those are the two situations. You ask them directly. You do not beat around the bush. Are you having thoughts of harming yourself? And if they say yes, your next question is, do you have a plan, or what is your plan? Right? You know how in psych, we're always talking about open-ended questions. You always want open-ended questions. There are very few situations that you ask closed-ended questions. Guess what? Suicide and abuse are one of those few, right? You ask them, are you having thoughts of harm? Do you have a plan? Yes or no? They say they have a plan. You ask them what their plan is. And this, by the way, this is another test question I'm about to tell you. The reason that you ask them what the plan is, here's the reason. You want to know the lethality of their plan. Them telling you what the plan is will tell you, okay, how lethal is this plan? If their plan is to jump off of Mount Everest, but they live in Florida, that plan's not as lethal as if they tell you they plan on using the gun that's owned by the stepfather that's kept in the garage and there's no lock. Okay? All right. So anyway, that's the answer to this question. Which side effect of an SSRI would you immediately report? Which side effect of a selective serotonin reuptake inhibitor, SSRI, would you immediately report? Here are the options: mild nausea, insomnia, increased energy with persistent feelings of sadness, dry mouth. And guys, this is another slide. As I was explaining something else, I inadvertently gave you the answer to this. You guys should all get this right. While you're thinking about your answer, let me tell you about SSRIs. This is the first line of defense. This is the first class of drugs that you expect to give when it comes to depression, right? Before a TCA, MAOI, before anything else is ordered, SSRIs are the first class of drugs expected to be given for depression. Professor D, do I need to know this? Absolutely. And the reason for that, the SSRIs have been proven to be most effective with the least amount of adverse effects on the body. Okay? Now, with that being said, I'm very happy most of you guys chose the correct answer. Increased energy with what? Persistent feelings of sadness. So you have energy, but you're still feeling sad. Uh-oh, you have just enough energy to do what? Off yourself. Okay, let me tell you something. When it comes to these psych drugs, yes, we're talking about depression, but across the board, guys, it could be depression, it could be antipsychotic drugs, it could be seizures. When it comes to these drugs that affect the brain chemistry, it takes weeks before there's a therapeutic level in the body. We don't expect to see results right away. It takes several weeks. So the fact that this patient has increased energy, but they still have that feeling of sadness, we're going to be concerned because that's a perfect combination for them to follow through with that plan. Now, let's look at the other options. Mild nausea, insomnia, dry mouth. These are side effects of SSRIs. These are things that you're going to teach a patient, hey, I'm giving you this medication. You may experience these side effects. These are things that can potentially happen. But if it happens, that's not something you're going to report to the healthcare provider because guess what? The dosage isn't going to change. That's something we expect to happen. There's a difference, guys, between side effect and adverse reaction. Side effect are things that may possibly happen. We warn the patient that it may possibly happen because we don't want them to stop taking their medication because they didn't know it was going to happen, right? Adverse effects are things that may possibly happen, but under no circumstances do we want it to happen. And if it does happen, we have to report it to the healthcare provider right away. You see what's in yellow, that increased energy with persistent feelings of sadness? That is an adverse reaction because if we see this, we have to report it to the healthcare provider because that is a very strong indication that the patient may live restricted for some audience. Or live contains themes that some may find uncomfortable and has been restricted. This violates community guidelines. Guys, hold on. I have to appeal this. Hold on. The decision is fair and the restriction is reasonable? No. TikTok should allow content like mine? Yes. I understand the decision, but the restriction is too strict? No. My live does not contain the content mentioned in the notice. Which should I choose? Should I say TikTok should allow content like mine? Or should I choose my live does not contain the content mentioned in the notice? What should I pick, guys? They should allow it? Okay, I'm going to pick that. I don't know if it'll get approved, but it said I'm violating, I'm using the S word. I'm sure that's what it is. I'm using the S word. It's mental health. Okay. Okay. What was I saying? I lost my train of thought. Okay, I don't remember what I was saying. But anyway, guys, that's the answer. And now you guys know why. The other options, by the way, those are side effects, but they're not adverse effects. Yellow is adverse effect. That's what we're concerned about most. We're always going to be concerned about what's going on the patient. Okay. Okay. Which statement about MAOIs indicates a need for further teaching? Would it be, I will avoid foods like aged cheeses and cured meats? Would it be, I should check with my healthcare provider before taking any over-the-counter medications? Would it be, I can drink red wine occasionally as long as it's in moderation? Or would it be, I'll call my healthcare provider if I experience severe headaches or racing heartbeat? Very good. Guys, when it comes to medications, there is no safe amount of alcohol, period. When it comes to medications, we're talking about pharmacology, alcohol must be avoided. Especially, guys, we're talking about MAOIs. Remember how I told you SSRIs are the first class of drugs when it comes to antidepressants that you expect to be given? Well, guess what? MAOIs are the opposite. They are the last class of drugs you expect to be given when it comes to antidepressant drugs. Why? There are so many adverse effects. It is ridiculous. Let me tell you something. You don't expect to give an MAOI until everything else has failed. This patient has been on antidepressants for so long that first class of antidepressants just don't work anymore, right? So the SSRIs don't work anymore. They've gone through the TCAs. They've gone through so many drug classes. They just don't work anymore. And finally, because we just have no other options, the patient's placed on an MAOI. But with the MAOIs, guys, there's so many adverse effects. There are so many drug-drug interactions. There are so many drug-food interactions. The patient has so many restrictions of different types of foods that they can't have. We really don't give this unless we absolutely have to. And when it comes to MAOIs, patients have to stay away from foods that are high in tyramine. Professor D, do I have to know what drugs fall under MAOIs? Absolutely. Professor D, do I have to know what type of foods and drinks fall under have tyramine that the patient has to avoid? Absolutely. You're going to see this as a test question some way, somehow, either in the nursing program, on NCLEX, or both. Don't say I didn't warn you. Okay? So when it comes to foods that are high in tyramine, I want you to think of, guys, what's the name of the fancy spread, like when people have parties and they have crackers and cheese and those little like meats, the deli meats? It starts with a C, something board or something table. What's it called? Yes, thank you. Charcuterie. Did I say that right? Charcuterie? I pronounced it correctly? Well, anyway, you know what I mean. That, right? Those things that you see on that board, stay away from. It's gonna be, so that's a good way to remember, guys. Those meats and cheeses that you would see on that board, the meats that you'd see in the deli meat, anything that is pickled, preserved, right? Good enough. Okay, good enough. You'd stay away from. Oh, good question. Thank you. Who asked that question? That actually is an NCLEX question, so I'm going to address this. I'm trying to find who asked it because I want to give you credit. Denise, thank you. Denise says, is cottage cheese allowed? Let me tell you something. That question, cottage cheese, that's on NCLEX, that's on HESI and ATI. And it's a trick question. It is allowed. Why? It's not aged. It's not aged. So it's allowed. Yes. All right. Don't say I didn't warn you. Anyway, let's talk about the choices that we didn't choose because those are the correct answers. That doesn't require further teaching. I'll avoid foods like aged cheese, cured meats. True. Can't have that, MAOIs. I'll check with my healthcare provider before taking any over-the-counter meds. True, because remember, when it comes to MAOIs, there are so many drug-drug interactions, including over-the-counter drugs and herbs. And last, I'll call my healthcare provider if I experience severe headache or racing heartbeat. True. What are we concerned about? Hypertensive crisis, because you can go into hypertensive crisis, mess around with these MAOIs. Okay? Your patient has antisocial personality disorder. Which nursing approach is best to implement? Here are your options. Offer frequent praise to encourage cooperative behavior. Allow the patient to have control over their treatment plan. Enforce rules and consequences in a clear and consistent manner. Or encourage the patient to discuss past traumatic experiences openly. Which one is correct? Your patient with antisocial personality disorder. Okay, most of you guys chose the correct answer, enforce rules and consequences in a clear and consistent manner. But there are way many people on this live that answered, so I'm concerned about that. Let's talk about this. First of all, many people use the phrase antisocial incorrectly. Medically speaking, in the nursing world, antisocial is not what many people think it is, because you're thinking antisocial, someone who's antisocial, they don't like being around other people. Let me tell you something. Someone with antisocial personality disorders, they love being around other people. They are very social. Why? They're con artists. They are con artists. They know they're social chameleons. They know exactly who to be around anyone to be able to con them. And when I say con, I don't only mean financially speaking. Yes, they're con men. They'll con you out of your money. But some may con you out of um I don't want to violate community guidelines. The activities that adults do, schmecks, okay? They can con you out of schmecks, right? Getting your body, right? They can con you out of getting your home, or con you out of your time, or con you to get services from you. That's what they do. When it comes to antisocial personality disorder, I want you to think of the 23-year-old young man that is dating the 84-year-old woman, and he got that 84-year-old woman to sign over her home, the deed to her home, and all of her bank accounts, and to take all of her children, grandchildren out of her will, and to only have him onto her will, right? That is the antisocial personality disorder. They love being around people. So a patient with antisocial personality disorder, you have to watch them because they're so good. They even con the nurses into getting, extra privileges, more phone time, more TV time, or whatever it is that they want. So you have to be very strict with the rules and not budge a little bit, because if you give them an inch, they're going to take a whole mile. Let's look at the wrong answer choices. Offer frequent praise to encourage cooperative behavior. That is not going to encourage cooperative behavior. They're going to take that praise and find a way to manipulate you with it. They don't care about your praise. It doesn't work. Next, allow the patient to have control over their treatment plan. Are you nuts? That's exactly what they want to do. They'll try to take control so that they can get what they want from every single person that's in that group therapy. And last, encourage them to discuss their past traumatic experiences openly. Guess what? They will lie through their teeth. They will start talking about trauma that never even happened to tug on your purse strings, to tug on the purse string of anybody else that's in that group therapy to get what they want. Right? No, you're not going to allow that to happen. You're not going to allow splitting to happen. Absolutely not. You're going to be very strict about the rules and the consequences. If they break whatever the rule was, they will suffer the consequences. All right, which of the following findings is most indicative of a serious complication associated with anorexia nervosa? Here are the options. Lanugo on the arms and face, amenorrhea for 3 consecutive months, blood pressure of 88/50 and heart rate of 42, or complaints of constipation and abdominal bloating. I'm sorry, I forgot to put my C, but it's complaints. Which is the most serious complication associated with anorexia? Blood pressure of 88/50 and a heart rate of 42. On the live, I saw a lot of you guys went with Lanugo, and a lot of you guys went with the amenorrhea. You got to be kidding me. You got to be kidding me. How many times have I said to you on this live that physiological integrity takes precedence? Keeping our patient alive takes precedence. Why in the world would we prioritize thin, fine hairs on the patient's arm? Who cares about that? By the way, thin, fine hairs, that's the Lanugo. Who cares about that? How does that put the patient's life at risk? Are you kidding me? And then the other half of you was on this live talk about amenorrhea. How is not having a menstrual cycle for 3 months putting their life at risk? How? Now, that blood pressure of 88/50, by the way, guys, the lowest your blood pressure is supposed to be is 90/60. 90 systolic, 60 diastolic. This patient's blood pressure is 88/50. And then to make it even worse, this is what kills me with you guys. I can't believe you guys even tried me like this. I even gave you a heart rate of 42. Normal heart rate is 60 to 100. The least that the heart rate is supposed to be is 60. I said 42, and you had the nerve to be up here and talk about amenorrhea. How? Anyway, and I'm not even going to talk about the abdominal bloating and the constipation. Again, if you guys take anything that I say to you during this whole live, if you take one thing away, take this. Whenever you're trying to figure out what your priority is, say to yourself, which one is going to harm, injure, damage my patient the most? And that's going to be my priority. Okay? Okay, which lab result would you prioritize in a patient with bulimia nervosa? Would it be blood glucose of 85, sodium of 140, potassium of 2.8, or hemoglobin of 13.5? Your patient is bulimic. Which are you going to prioritize? Excuse me. Very good. Very good. Potassium 2.8. Potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything less than 3.5 or anything higher than 5, patient's going to have what? Cardiac dysrhythmias, right? That would put your life at risk. That's going to be our priority. What's wrong with the blood glucose of 85? Normal blood glucose 70 to 110. Sodium's good. Sodium's 135, 145. Hemoglobin's good. It's not low. The only thing that's abnormal here, guys, is that potassium. All right, ordered response. Your patient's diagnosed with schizophrenia and they're experiencing auditory hallucinations and paranoia. Put the nursing interventions in order. What are you going to do? First, second, third, fourth. If you're inside the Kahoot, guys, take your mouse and put these options in order. If you're on the live, just type the color that you put in the correct order. Here's our options. Administer prescribed antipsychotic medication as ordered. Assess the content of hallucination. Set clear boundaries and expectations to provide structure and reduce anxiety. Maintain a calm, non-judgmental attitude. What are you going to do? First, second, third, and fourth. Again, this is a schizophrenic patient that's having auditory hallucinations and paranoia. Huh. Only 8 of you guys got it right on the live. And excuse me, on the Kahoot, only 8 of you guys got it right. And on the live, I did not see one person get it right. I may have missed you, but I did not see one. So let's talk about this. Your patient's schizophrenic and they're having auditory hallucinations and paranoia. As a nursing student, the instant you see auditory hallucination, the very first thing that should be going to your mind is command. You have to find out, make sure that it is not command hallucinations, because you want to know what the deadliest type of hallucinations is when it comes to auditory hallucinations? They're command hallucinations. Because when a patient has a command hallucination, they have a voice in their head telling them to do something. They feel compelled to do it. They can't stop themselves. So if they're having a voice in their head telling them to jump out the window, guess what that patient's going to try to do? Literally jump out that window. Okay? So when you see auditory hallucinations, the very first thing that you're going to do is this right here. Assess the content of the hallucination. How do you do that? What are you hearing? Notice I said, what are you hearing, and not what are these voices saying? Because the minute you say, what are these voices saying, you're giving, am I saying this correctly? Credence? You're giving credit? You're giving, what's the word I'm looking for? Validity, because I don't know if credence is a correct word in English. But you're giving validity to the hallucinations. So you don't say to the patient, what are the voices saying? Because when you say, what are the voices saying, you're letting the patient know that these voices are real. You hear them too. You just want to know what they're hearing. Don't do that. You're going to get that wrong. You ask the patient what they are hearing. So that's an open-ended question without validating those voices that the patient's hearing. And why are you asking that? Because you want to make sure that that patient's not having command hallucinations. And if they are, you want to know what those command hallucinations are. Because what if that command hallucination, the voice is saying, punch your nurse dead in the throat? You better be ducking and weaving, right? So you need to know what the voice is saying. So the first thing you're going to do is assess the content of the hallucination. That is your first priority. After you do that, then you're going to maintain a calm, non-judgmental attitude. Why? Because you're about to provide directions to the patient. You have to be calm because remember, they're paranoid. You have to be calm and you have to be non-judgmental. You want them to be compliant. After that, you're going to go ahead and give the directions. You're going to set clear boundaries and expectations. You want to reduce that patient's anxiety and you want to let them know that they're safe. And last, you're going to go ahead and administer, Haldol or whatever psychotic medication's been prescribed for this patient. That's the order that you do things. And guys, this is how NCLEX wants you to think. This is how the test writers want you to think. If you're currently in a nursing program and you're in mental health, this is how your teacher wants you to think. How are we doing on the live? Very good. Okay. Your patient's diagnosed with severe anxiety and reports feeling of impending doom, a rapid heart rate, and shortness of breath. What is your nursing intervention? Are you going to encourage the patient to explore the possible sources of their anxiety? Are you going to provide the patient with information about anxiety and coping strategies? Are you going to stay with the patient and encourage slow, deep breathing exercises? Or are you going to assist the patient in identifying irrational thoughts and irrational thoughts contributing to anxiety? Very good. The patient has feeling of impending doom, which means they feel like they're going to, right? Rapid heart rate, shortness of breath. You're going to stay with them. You're going to talk in a very calm manner. You're going to speak slowly and not teach them, but help them do the deep breathing exercises to get them to calm down. Why did I say you're going to speak slowly? A patient with severe, you see that word severe in front of anxiety. It's not just anxiety because you have different types of anxiety. You have mild anxiety, you have moderate anxiety, you have severe anxiety, and then you have psychosis. I'll talk about that in a minute. But anyway, the patient with severe anxiety, their thought process has slowed down. And when I say slow down, their ability to process thoughts is slowed because they're so anxious. So that's why you're going to slow down your speaking and speak very calmly. Now, if you were to get a question like this, the same question, and then the options, I'm going to add one more option. I'm adding the option of assess your patient. And when I say assess your patient, assess their heart rate, assess their respirations. What is going to be the answer? It's going to be assess your patient. Here's why. Yes, the patient has anxiety. They've been diagnosed with severe anxiety, right? And even though that feeling of impending doom, rapid heart rate, shortness of breath, even though all of those are symptoms of severe anxiety, they can also be symptoms of what? A myocardial infarction. Between those two, which one takes precedence? A myocardial infarction, right? So you're going to assess your patient. Here's the thing. NCLEX wants to make sure you're not the nurse that's going to assume. You're the nurse that's going to check. You're the nurse that's going to get information and assess your patient. So if that was there, that's what you would have chosen as the answer. And I'm telling you, NCLEX has had that as an option for over 2 decades now. What are we in 2024? Yeah. Okay. It hasn't changed. The question will be different, but the concept is still the same. I didn't have that as an option. So the next best answer is staying with that patient and having them take slow, deep breaths. Now, let's talk about different types of anxiety, because that also is a test question that's been seen on NCLEX, HESI, ATI, just regular mental health exams that you need to know. Mild anxiety. Mild anxiety is a good thing. It's good. Mild anxiety makes you more aware. It makes you more alert. It's an incentive to do better, right? Anyone who's been in the nursing program has, at the least, has had mild anxiety. It's mild anxiety that, when I was in the nursing program, it was mild anxiety that would make me turn off the TV and study. Why? Because I didn't want to fail, right? It's that mild anxiety that will make you as a student study because you don't want to fail, okay? As a woman walking through a parking garage at nighttime, I'm walking towards my car and I have what? Mild anxiety. And it's that mild anxiety that helps me to be aware of my surroundings. As I'm walking towards my car, my head's on a swivel. I'm looking left and I'm looking right. I'm looking left and I'm looking right, and I'm ready for someone to run up on me because they're going to catch these hands, right? That's mild anxiety. That makes you alert. That makes you ready. Mild anxiety is a good thing. Severe anxiety is not, because severe anxiety, your thinking, your thought process starts to slow down and you're not as aware because you're so anxious. And my goodness, if you get to the point of psychosis, you're out of touch with reality. That's how bad your anxiety has become. You're completely out of touch with anxiety. Your thinking and your learning has been impaired. So guys, you got to know the difference between those. Let's look at the answer choices. Encourage a patient to explore possible sources of the anxiety, not while they have tachycardia and shortness of breath. Absolutely not. We do teaching once the patient stabilized. Providing the patient with information about anxiety and coping strategies. Again, we only teach once our patient's stable. And last, assist the patient in identifying irrational thoughts contributing to anxiety. That's a wonderful thing to do. But again, we're not going to do it until our patient's stable. While we have something acutely happening to our patient, we have to assess what is acutely happening to our patient. Okay? True or false? Acting out behaviors opposite to what you feel is known as reaction formation. Is this true or is this false? Acting out behaviors opposite to what you feel is known as reaction formation. It's true. Reaction formation is acting the opposite of how you feel. So, for example, you cannot stand your clinical instructor, but every single time you have clinicals, you bring them their favorite chocolate, knowing you can't stand them, right? You're acting the opposite of how you feel. Reaction formation. And that is a defense mechanism, by the way, that you have to know. Select all that applies. You're assessing a patient with schizophrenia. Which of the following findings indicate the presence of negative symptoms? Select all that apply. Anhedonia, hallucinations, avolition, delusions, flat affect, and alogia. Your patient has schizophrenia. Which ones are negative symptoms? And you guys absolutely must know the difference between negative and positive symptoms. You have to know the difference. If you're in school right now, you're taking mental health, you're going to get at least one question on this. Don't say I didn't warn you. Okay. Hmm. Would it help if I told you that positive symptoms are things that are present that should not be present, and negative symptoms are things that are not present that absolutely should be present? So, positive symptoms are things that the patient has that they should not, and negative symptoms are things that the patient does not have that they should have. What do I mean by that? Let's talk about it. We're looking for negative symptoms. So we're looking for things that the patient does not have, but they should. Anhedonia. First of all, when you see that letter A in front of a word, usually means to be without. They're lacking something, right? Remember, negative symptoms are things that you're lacking. You don't have, but you should have. So anhedonia is lack of what? Happiness, enjoyment of things that they used to have. What is this? Hold on, guys. Whoever just reported me, I'm teaching mental health. Please don't report this live. I'm teaching mental health. Okay, guys. So, anhedonia, that is lack of enjoyment in things that the person used to enjoy. So they're missing it, they're lacking it. So that's a negative symptom. Avolition, that is lack of motivation to do things that they need to do. That's not having something that they should have. That's a negative symptom. A flat affect, that's not having the affect is not the emotion, but it's appearance. There we go. Not having the appearance of emotion that they should have. Okay. If you have a flat affect, your face is just like this. You can't tell if the person's happy. You can't tell if they're sad. You can't tell if they're enjoying themselves, nothing. Okay. They're lacking that emotional response where they should have it. So a negative symptom is lacking. And allogia, I don't know if I pronounced that correctly, but you see it, guys. And that's not having speech, not having the reply. So you're lacking the words that you should have. You're missing them. Now, hallucinations and delusions, these two are not negative symptoms. These are positive symptoms, because hallucinations and delusions, they're things that the person does have that they should not. Are you supposed to have hallucinations? No. Are you supposed to have delusions? No. So those are positive symptoms. You need to know that. Here's something else that you need to know: the difference between hallucinations and delusions. You need to know the difference between the two. So hallucinations are having a false sense. So smelling something that's not there, seeing something that's not there, feeling something that's not there, hearing something that's not there. That is a hallucination. A delusion is having a false belief, believing that everyone is out to get you, believing that you're Michelle Obama, believing that you have $1 billion in your bank account. Okay, so delusion is a false belief, where a hallucination is a false sense, whether it's hearing, seeing, feeling, smelling, whatever. Okay, so make sure you know the difference between those two. Last question. You're assessing a patient who presents with multiple bruises in various stages of healing. What would be your best response to this? Did someone at home cause these injuries? You don't have to tell me what happened if you don't feel comfortable. You seem hesitant. We can keep this conversation confidential. I notice you have several bruises. Can you tell me what happened? Which is the best response? Very good. Very good. I notice you have several bruises. You're making an observation. Guess what? That's a therapeutic response. And then you follow that up with, can you tell me what happened? Can you tell me what happened? That's a closed-ended question. And remember, I told you, we really don't ask closed-ended questions except for, I don't want to say unaliving self, abuse, and quick assessment. And so this satisfies that situation. Can you tell me what happened? I thought I was going to trick more of you guys with the red one where it says, did someone at home cause you these injuries, right? I thought I was going to trick you with that, but I'm happy I didn't. Here's the thing. Even though when it comes to abuse, you ask them directly, you don't point the finger to anyone. And here's why. Even though that person is abusing them, they still have a sense of obligation and they don't want to feel like they're betraying that person, right? So you don't say, is your husband, is your boyfriend, is he, is she, or even someone at home, because then they feel like they have to defend the people they live with or the people that they love. Is anyone hurting you? Is anyone harming you? You make it a broad statement so that way they can say yes, right? And then you continue that conversation until they're willing to tell you who it is. But I'm telling you, if you direct your question towards a specific group of people or person, that's not going to be your answer because the person's going to shut down on you. Now, so that's not the answer of the one in red. Now, blue, you don't have to tell me what happened if you don't feel comfortable. Well, great. You just shut it down now. How are you going to find out that that person's being abused? Look at the question. It says that you're assessing a patient with multiple bruises in various stages of healing. The minute you see multiple bruises in various stages of healing, you know we're talking about abuse. If this was a pediatric patient, let me tell you what the question would be. It'd be that, or they tell you that the patient has a spiral fracture. Well, duh, spiral fracture, you know we're talking about, again, abuse. So anyway, we don't want to shut it down. So we're not going to tell them, oh, you don't have to talk about it if you don't want to. We need to get this patient in a safe environment. And last, you seem hesitant. That first part is actually good, right? You're making an observation. That's therapeutic communication. But remember what I taught you. I've said this a million times. You may have a beautiful answer and then a comma, and everything after that comma is wrong. If the whole thing is not right, the whole thing is wrong, throw it out and go with the next best answer. So let's see what comes after the comma. We can keep this conversation confidential. First of all, when it comes to abuse, you're a mandated reporter. So you either just lied to your patient or you're not doing your job. You're putting your license at risk. Which one is it? Right? So the only correct answer here is making that observation and then asking them about it in a very broad way, very open-ended way so they can talk about it. C says, I just passed my NCLEX this Saturday with your help. Thank you. You're welcome. Congratulations. Congratulations. And guys, that is the end of this Kahoot. Please let me know what you thought about it. I'm so sorry. This Kahoot was much longer than it normally is. But there's just so many important things that you guys need to know when it comes to mental health. Please let me know in the comment section what you thought about this video and if you'd like to see more subject matter on mental health, or maybe you'd like me to make a video specifically on one of the topics that we talked about. And be sure to check out my website, nexusnursinginstitute.com. If you'd like private tutoring from me, or you'd like NCLEX review, because I do provide reviews once a month, you can sign up for that. If you're currently in a nursing program and you're really struggling, you have to do really well on your next exam just to stay in the program, go to my website and sign up for audio lesson. Whatever is going to be on your next test, find my audio lesson on that and get that learning in and make sure you stay in the program, right? So check out my website, nexusnursinginstitute.com. Almost daily, guys, I cover a variety of nursing topics across my social media platforms. TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. But if you want to study, you want to get some in-depth teaching from me, YouTube is where it's at. Check me out on YouTube, Nexus Nursing. All right, guys, let's see how you guys did.